Good afternoon. Osstem meeting 2022 live surgery. I'm going to lead this live surgery. I'm Dr. Hyunjun Chung. Thank you for inviting me, and I would like to thank the chair of the session, Kyungwon Kim. In this live surgery, I'm going to talk about all-on-X surgery. First, the patient information and treatment plan. The patient is a 58-year-old male. He has underlying disease hypertension. To control it, aspirin is what he takes. After confirming that there is no medical problem, the drug was stopped from 3 days prior to the surgery. Dental history includes he lost many teeth due to periodontitis. Pre-op portrait without wearing a denture. The lip support is not bad. So this is the intraoral photos pre-op. The remaining teeth in the mandible were extracted on 27th of April due to mobility and others. This is panorama, pre-op panorama. The patient did not use denture before. Dental digital system is used to make a treatment denture using digital approach to stabilize the mandibular position. If the denture fits, that would be scanned and it would be reversed to fabricate a guide. First, the impression needs to be taken. The dental system has stylus pins in the stock tray. Using Gothic arch concept, the patient's VD and mandibular position can be set. The data is digitalized, so digital denture is designed. After the design, the surgeon approves it, and the try-in denture is used to check occlusion and adaptation. After try-in the portrait, compared to before using denture, lip support is improved, as evidenced by the portrait of the patient encephalo. Using the try-in denture to make a guide, tried-in denture will be scanned and reversed. The stability of the try-in denture is directly linked to the stability of a guide. So we need to pay extra attention to that. So this is the treatment plan for today. On the maxilla, 6 implants in parallel, and in the mandible, 4 implants including 2 tilted implants will be placed. For this, OneGuide design is done. OneGuide reports of maxilla and mandible are cropped and prepared. You may ask, can we place implants in the lower posterior region? Especially at number 36, the residual bone and the thickness of the soft tissue over the alveolar bone is analyzed here. In the implant studio, 6 and 7 millimeter short implants are virtually placed, and they're too close to the inferior alveolar nerve, invading the safe space of 2 millimeter zone. At number 47, the soft tissue thickness and the bone above the inferior alveolar nerve are not sufficient. So, in the interforaminal space, bone is hard and sufficient, but the bone gets less and less toward the posterior region. For a full arch case in mandible, a guided surgery is to be used. To fix the guide, if strong force is applied, soft tissue on the lower posterior will be pressed down. The risk would be increased in this case. First, in a similar case like this, I place the implants in the safe area, the interforaminal space. Later, if the patient gets ready economically and physically, implants will be placed using a guide in the lower posterior region. Vertical bone augmentation and the soft tissue graft can be done. This way, more challenging procedures can be performed with predictability. So that is possible because of Osstem multi-tie base. The tie base uses the library. So over the multi-abutments or multi-angled abutments can be connected, and temporary prosthesis can be designed and milled. So that's all thanks to this multi-tie base of Osstem. So multi-abutment will be connected, and tie base will use as an intermediary. And I will check a prosthetic adaptation if it is appropriate. The tie base will be cemented to the pre-milled temporary. So today's treatment plan summary. First, implant will be placed with OneGuide system. Mandible first, and multi-abutments will be connected. Multi-angled abutments will be connected, and TI base will be connected, and temporary prosthesis adaptation will be checked. In both jaws, adaptation will be checked, and the vertical dimension, mandibular position, and occlusal plane will be checked again. So if in the mandible or maxilla, primary stability is not achieved, during the osseointegration, treatment denture needs to be used. So because of that, from the design stage, I prepare the guide and provisional prosthesis. So the treatment denture and the temporary prosthesis prepared today can be used without distorting the occlusal plane. So in today's live surgery, we are going to look at the accuracy of Osstem OneGuide system. Second, the temporary denture selection depending on the primary stability and occlusal plane of temporary prosthesis. And the convenience of a digital approach will be explained. Now let's get started with the live surgery.
네.
OneGuide system, full arch restoration, and immediate loading.
네.
Have you checked? 3:25 p.m. We will now begin live surgery.
자, 저는 오늘 이 라이브 서저리를 위해서
For live surgery, I'm going to prepare all-on access system. I'm going to start with lower. Guide is not connected. Tissue punch is done.
이용해서 인덴테이션을 줍니다.
I'm going to make indentation using tissue punch. By purpose, before you placing anchor pin, position is being checked. In the AM, as Dr. Park has mentioned, in order to fixate the implanted template, tissue punch is made to find the position and gingiva is being removed. So if it is in between mucosa, you don't need to pull with strength, but you just need to use the blade to remove it. Tissue have all been removed. Guide will be adapted. Anchor drill is going to be used to firmly fixate the template. Lateral anchor is used. Lateral anchor will be placed and preparations are being done.
앵커 스크루를 고정하겠습니다.
Anchor screw is now going to be fixated.
80% 정도의
For about 80%. So he placed the one in the middle very first.
3점에서 고정하고
Lateral anchor, when you fixate it, you make sure it's not tilted. So 80% it's being placed using engine.
나머지는 고정하면 아프시지 않으시죠?
Are you in pain? Because it's fully edentulous, guide fixation is the key. As Professor Changju Bak has mentioned, the template shouldn't move to provide accurate implants. Guide is firmly fixated. Flattening drill is going to be used to make the bone flat and secure. I'm going to secure biological width. So we're planning to place implants slightly deeply, and flattening drill is used to flatten the alveolar bone. Number 42 and 32. For accurate placement, flattening drill is used to remove the lumps to prevent the slipping.
예, 술자로서 제가 생각하기에
As a surgeon, Osstem OneGuide kit, among the different components, flattening drill has clinical meaning in that it's very useful. It has most clinical meaning because
임플란트의 장기 유지를 위한
to maintain the implant
그 부분을
tools,
제공해줌과 동시에
using the tool you can get the biologic width to fixate it and you can make the bone flat.
드릴이 미끄러지지 않겠죠.
The drill will not slip.
임상적으로
Clinically, I believe it's very meaningful. Initial drilling is done
뼈에 하악이기 때문에
because it's lower.
실은 오늘 초기 고정을
Primary stability
중요하기 때문에
is very important today and it's lower.
일단은 소프트 본용 이니셜 드릴을 한번 사용해 보고 있습니다.
I'm going to use initial drill.
느끼는 점은
My impression is that in the lower posterior,
임플란트를 계획하고 있는데요. 실제로 골질이
the bone quality is, compared with anterior, is weaker.
이니셜 드릴 중에 받고 있습니다.
That's the impression I get when I'm doing initial drill.
특히 45번 쪽이
In number 45, it's especially so. So, initial drill for soft is used. Initial drilling is done in 4 areas. In lower anterior, number 32 and 42. In the designed area, path drill is done. Prep work is being done. The drill that I'm using is 3.5 by 8.5 OneGuide drill. And next, he's using 4.0 by 8.5.
긴장을 풀어주세요.
Please relax a little bit.
저희가 원가이드 이와 같이 라이브 서저리 시행할
When you do
때는
live surgery,
그 어시스트와 출자도 중요하지만
assistant and the surgeon is important, but cooperation from patient is very important.
굉장히 잘 도와주셔서
The patient is really very cooperative,
계획된 시술을 잘 보여드릴 수 있는 겁니다.
so I'm able to show you what I've prepared.
32번에
In number 32, implant is being placed.
가지고 약 80%
It's being placed approximately 80%, and fixture driver is used to place it 100%.
하악의 전치 부분
It's lower anterior number 32, and number 42,
파이널 깊이까지 조절해서
it is adjusted up to the final depths.
깊이와 이
Depths.
노란선을 정렬하는 것에 주의하고
So you need to pay attention to the yellow line.
지금 제가 사용하는
In terms of depths, I'm using implant anchor,
버티컬 앵커
vertical anchor system.
임플란트 앵커를 2개 정도
So I'm going to additionally use a vertical anchor to place tilted implant in the posterior area,
후방 볼이 상대적으로 부족한 후방으로 침하되지 않도록
so that the implant does not sink down in the posterior area where it's lacking bone.
픽처 앵커를 이용해서
Fixture anchor is used, vertical anchor is used
스태프에서는 시행하죠.
to prep the posterior sites.
지금 사용한 것은
What I'm using right now is a 7mm.
괜찮으세요?
Are you okay?
7mm 길이의
7 by
드릴입니다.
7mm path drill. In number 35,
창이었기 때문에
it's extraction socket.
패스 드릴
Path drill is used
드릴이 프레퍼레이션 중에 미끄러지지
so that the drill does not slip during prep.
예, 아마 오전에 우리 박창길 교수님 말씀하셨듯이
As Dr. Professor Park has mentioned, in order to prevent the drill from slipping, in the case of extraction socket, the path drill needs to be used.
저희들이 원가이드 드릴 자체가 테이프
The OneGuide drill is with taper type.
그 발치와 같은 경우에
In the case of interior area,
저의 경사면에서는 미끄러지지 않도록
in
패스 드릴을 적극
the slope of extraction, you need to pay attention so that the drill does not slip. A primary stability, when you
파이널 드릴
are
시행하다
when you have doubts,
생략함으로써
you can forego final drill to get the primary stability.
옵션 중에 하나입니다.
That's one of the options we have to get primary stability.
후방 틸트 임플란트 두 개는
The two tilted implant in the posterior, 4.5 by 8.5, TS4 Osstem implants are used.
식립하겠습니다.
예, 그래서 파이널 골즈를 위해서 아까 보니까
For final
파이널을 가지고
drill,
속도로 한 번 더 본 퀄리티 확인하시고
the placement speed.
제 위치를 들어가고 있습니다.
Two implants are being placed in space. I need to get primary stability, and that is the key for me.
자, 아무래도 하악에는 지금 저희가
Because in the lower,
바로 프로비저널 레스토레이션을 시작할 예정이기 때문에
we are going to provide immediate provisional. If you look over here, it's over 30 Newton. So primary stability today, it's good.
그게 끼임 현상은 때문에 잘 시행하고 있는 것
It's not stuck, so it's going nicely. Can you say I?
이런 기구를 통해서
Using this kind of spoon type of instrument, you can make sure that whether the yellow line and slot is in line.
30N까지
30 Newton centimeter.
잘 나오는 걸 볼 수 있습니다.
총유 고정이
It's flushed with the yellow line. You can see that.
네, 정 원장님 만족할 만한 스테빌리티가
Dr.
나온 것
Chung, I think primary stability is good. Thank you.
최선을 다하겠습니다.
I'm doing my best.
전방부에
On the anterior area for fixation,
임플란트 앵커를
implant anchors, which were used, will be removed.
앵커 스크루를
Anchor screw,
앵커 스크루를 제거하겠습니다.
I'm going to remove them.
정 원장님 제 말씀 들리세요?
예,
Dr. Chung, can you hear me? Yes.
정원장님 제 얘기 들리세요?
Can you hear me?
잘 들립니다.
Yes, I can hear you.
예, 라테럴 앵커 스크루.
Lateral anchor screw is being removed.
주세요. 다시 드세요. 다시 드세요. 자, 어버트먼트 준비해 주세요.
Can you prepare abutment?
인터컴 스위치 잠깐 개선하시겠습니까? 그냥 진행할까요?
Can we proceed?
정원장님 제 얘기 들리세요?
Can you hear me?
네. 인터컴
Yes.
스위치가 안 들린다는.
I think intercom switch they can't hear.
들리시나요?
예.
Can you hear me? Yes.
조금 인터컴이 문제가 있었던 것 같아요.
I think we had a bit of a technical glitch.
멀티 어버트먼트.
Multi-unit abutment is being connected.
아, 지금 인터컴.
들려.
들리시나요?
예, 들립니다.
아,
예.
이게 자꾸
Can you hear me?
현상이 있는 것 같습니다. 조심하겠습니다.
So we'll pay more attention with the technical stuff.
치부에 있는 툴핀 쪽은
The tilted implant in the posterior area.
노출이 돼 있을 수도 있고
Bone may be exposed, therefore abutment it may be easy. It may not be easy to put the abutment. I'm going to form a mini flap
를 한번 확인하고
to check the bone.
네, 이쪽은 지금 이게
On this side, it's extraction socket,
시원하게 한 번에 툭 열리지 않고
so it does not open as nicely.
예, 아마 위에 걸리는 돌 조직을 약간 플랫팅 하시고.
So flattening drill is used.
정원장님 지금 임플란트의 뒤쪽에 있는 뼈를 삭제하시는 거죠?
Are you removing bone distal to implant in this
전방도
case?
중요하지만 후방에 있는
Anterior side is important, but
전방 모두 중요한데
posterior side is also very important. In the posterior side, there is interference.
멀티 앵글도 어버트
Multi-angled abutment
앵글도 돼.
is not being connected. Now he's connecting it.
주의해야 되고
You need to be careful
이 부분이
in this area.
좀 이번 수술에서
So this is the most tricky area out of the entire surgery.
손잡이 부분을 될것 같아요.
Handle is removed.
네, 30번 때는 좀
In number 30,
어버트먼트가 체결하셨고
abutment is connected, and in number 40,
조그맣게 플랩을 형성해서
Mini flap is formed
시키고
to expose it slightly.
석션. 잘 잡아주십시오.
Please hold.
식립된 임플란트의 디스탈 부위에
Distal to the place to implant.
착지하고 계십니다.
It's being prepped.
네. V 석션 해주세요. 석션. 빼주세요.
Please remove it. I cannot really see.
앵글도 어버트먼트 제가
Angled abutment is connected.
석션 부탁드립니다.
Suction, please.
좀 치워주세요.
네, 토크는 30뉴턴으로
So torque is 30 Newton? Yes, it's 30 Newton.
TI 베이스 주십시오.
Please give me tie base.
예, 지금 4개의
Four angled abutment, multi-unit abutments are connected.
그 위에 TI 베이스
And on top of it, tie base
공기
is connected.
6mm 높이 헤이트에
6mm height, 5-degree taper.
TI 베이스를 선택하였습니다.
That's the tie base that I chose.
TI 베이스를 체결하고 계십니다.
Tie base is being connected.
우선 플랩을 닫기 전에
Before I close flap,
보철물의 적합을 한번 보겠습니다.
I'm going to check the fit of prosthesis. Tie base is connected and the prefabricated prosthesis is being tried in.
잠깐만 다물어 주시겠습니까?
Can you close slightly? Thank you.
예, 보철물의 적합은 괜찮은 것
The
같습니다.
fit looks okay.
이후에 워시해서
After that, I'm going to wash and increase the set fit, and then I'm going to place it. I'm going to do suture now.
보철물의 적합
철물을 시작을 해보셨는데 어떻게 잘 맞는 것
You
같아요?
tried in.
네,
Do you think it fits nicely? Yes.
들어간 것 같습니다.
I believe it has been placed in the planned position.
플란트의 식립 깊이가
The placement depths
어떤 위치보다 아주 약간
slightly
깊게 들어갈 때
more so than the planned position. It can go in slightly deeper. In this case,
갭이 생기는 효과가
there can be gap with the prosthesis.
그 임시 보철물이 잘 들어갈 수 있겠습니다. 그런데
The provisional can go in nicely, but
우리가
in this case,
오론 X 시스템이기 때문에
because it is all on X,
플랜지처럼 약간의 형태가 있기 때문에
there's a bit of a flange
남아 있는
because it's all on
시은에 다
X. It hits the residual gingiva so you can fit accurately. That's the way I designed the provisional.
끝나고
So after all surgery is done,
워시하는 과정에 있어서
in the washing process,
그때는 워시하는 과정에 있어서는 너무 과한 플랜지는 조금
excessive flange will be removed
사용 기간 중에
so that
셀프
self-cleansing can be done by the patient easily.
음식이 많이 저류하지 않도록
And so that food impaction can be prevented.
조철의 수정 과정 중에 시행할 예정입니다.
Adjustments are going to be made.
쫓아오고 있는데요.
Osstem 2022 Live Surgery. The slogan is a little bit easier digital in day-to-day activities. So if you have a bone loss in the mandible, as was presented before, the implants can be placed in the mandibular posterior, but to provide a vertical step as an initial stage, the OneGuide surgery is being done to place implants. So we try to find an appropriate patient for this indication, and the surgery is smoothly progressing. The guide template we have prepared is going to be connected. I cannot hear the intercom. Can you hear me? Now I can hear it. The guide template is set. So the guide is fixated with the hand on the maxilla, and using a tissue punch, the indentations are made. Once again, the tissues are removed in this process. So using a tissue punch, the tissue is removed. The teeth are not good. So the patient, the position is a little bit modified. For better visibility. Now, tissue punch is used to remove tissue, and the template is mounted again. Can you say ah for lateral anchor? Can you say ah? To the maximum. So in the planned positions, the guide is fixated. Do you feel pain? Can you say ah? Anchor screw design. It is not to be inserted in a slant way. If it is designed obliquely, the guide can shift while it is being pushed in. Say ah, please. Open your mouth. It's a lateral anchor, but still without deviation. It is designed in a straight way. Unexpectedly, when anchor screws are coming in and the maxilla, we can estimate the bone quality. The upper posterior bone quality is softer than I thought. The density is low. So when we place implants in the maxilla, we need to check whether primary stability can be obtained. If it is not possible to obtain the primary stability, the patient's old denture
파악은
is going to be used on the maxilla and in the mandible.
시행하는 것으로
Immediate loading will be applied.
양식을 결정하여야 할 것.
So that's how we determine the mode of temporaries. So there's just some unexpected situations. So we have two options. As I mentioned during the presentation,
파악은 원래 사용하고 계셨던
maxilla,
파악은
I'm going to use the digital temporary denture.
이렇게 혼용을
It's going to be used different from
혼용이
mandible, and to use the combination before live surgery. I'm a fan of Dr. Jung In-bae, and I listened to his presentation carefully. So if you use a treatment denture
리버스 스캔을 해서 가이드를 만들어서 이 가이드
and it's a reverse scanned and make a guide,
벤처
the denture, the guide, and the temporary
만들어질 수 있도록
can be made.
그 과정을 통해서 그 보철물 간의 혼용이 있더라도
So
표현을 최대한
combination of prosthetics can be used to maintain, and the occlusal plane would be maintained. So do you feel any pain? Is it painful? So flattening drill is used, and now initial drill.
약간 마취를 해야 될 것 같아요.
So I need to inject the anesthesia. Patient seems to feel pain.
지금 실은 제가 저의 임상 경험에서
Based on my clinical experience in the upper anterior, there are two reasons for the pain. Sorry about this. First, in the upper anterior, on the buccal side, the anesthetic was not sufficient, and in the incisive canal, the anesthesia was not sufficient. And sometimes the patient feels pain if the anesthesia was not enough. So the area is
아프세요?
to be receiving anesthesia injection. So the patient feels pain because it's bleeding, and the patient can feel pain. So I'm using a new long needle.
조금만 부탁드립니다. 예, 한번 마취가 되면 아프지 않기 때문에
So once the anesthesia kicks in, it's going to be okay.
조금만 힘을 빼주세요.
Relax a little bit. Are you okay?
환자분이 아마 통증을 좀 느껴서 약간
I think the patient is a little bit tense because it was slightly painful.
선생님 불편하시면
Are you
다시
uncomfortable?
말씀해 주세요.
Please tell me if you're uncomfortable.
드릴이
The drill that you're using, what is the length?
드릴은 길이가 3.5에
3.5 by 7.
지금 저희가 디자인을 함에 있어서
In doing drilling,
공기 길이 8.5의 임플란트를
3.5 by 8.5 implant is designed.
해당 부분은 약간 더 마취를 해야 될 것 같아요.
I think we need more anesthetics.
식립 속도를 한번 바꿔주시겠습니까?
So can you change the placement speed?
부치부에
In the posterior area,
3.5의 10mm
4.5 by 10 millimeter was designed.
굉장히 소질이
The bone quality
소프트에서
is very soft.
승립 모드로 돌리면
Placement mode is used to check.
쉽지 않고
I don't think it's going to be easy to do immediate loading here in the posterior area.
양 하염과 사이너스가 동시에
There's sinus
측정형태이기 때문에
as well as the inferior border of the nasal cavity. So I'm going to use a size longer drill to prep the site
전에
before placement.
그 21번 부위가 맞죠? 계속 안
Number 21. Anesthesia, it's not really being done. I'm going to do it once again. Relax a little bit.
자,
Okay.
임플란트 식립하겠습니다.
I'm going to place the implant.
4.0에 8.5입니다.
4.0 by 8.5. 4.0 by 8.5. Yes, that's right. Final drill is going to be done by 3.5. 4.0 drilling is not going to be done full length.
직전에서 멈췄습니다.
I'm going to stop 2 millimeters before.
두개 전치부에 11번, 21번 부위에
In 11 and 21's 4.0 by 8.5 implants are placed.
13번 부위에는
In number 13, 4.5 by 8.5 is going to be placed.
엔진으로 약 80% 정도.
So it's being placed with engine about 80%.
그다음에 23번 부위에
In number 23,
4.5에
4.5 by 8.5 implant is going to be placed.
각 5번 부위는
Number 5, 4.5 by 10 millimeter is
전치부에
prepared. In the posterior area, bone quality is not very good.
엔진으로 약 80%.
Engine is used by about 80%.
마찬가지로 25번 부위도
In number 25, 4.5 by 10 millimeter is being placed.
초기 고정을 얻을 수 있다면 정말 좋겠는데
I wish I can get primary stability, but it doesn't look easy. In the anterior area, it's 30 Newton centimeter.
11번부터 했던
From number 11, implant placement depth is being adjusted. Number 21.
13번 부위입니다.
Number 13.
어떻게 스테빌리티가 어느 정도 나오는데요?
How much is the primary stability? It's 30 Newton centimeter.
23번입니다.
Number 23.
네, 마찬가지로 한 30뉴턴 정도.
About the 30 Newton centimeter.
예, 전치부 4개 임플란트는
4 implants in the anterior. Initial stability, primary stability looks good. Number 15, posterior area. I think that's the issue.
한 10뉴턴.
I think it's about 10 Newton,
20뉴턴.
about 20.
실은 저는 이제 실제 임상에서는 이 경우
In actual clinical practice,
선호하지는 않습니다.
I don't prefer immediate loading because in the upper,
6개를 하더라도 이미디어트
even if you place a 6 implant,
얻지 못한
if you can't
있으면
get the 30 Newton in one area, failure can occur.
지금 15번에서
In number 15, it's barely 30, and in the rest of the area, as planned, immediate loading is going to be done, but when doing occlusal adjustment, I'm going to make it so that not strong occlusal force is not applied to number 15.
아쉽지만 한 3-4달 동안 조금 더 유연한 음식
I'm going to ask the patient to eat softer food for next couple of months to overcome the situation. Anchor screw is being removed.
네, 지금 수술이 빠른 속도로 진행이 돼서
Surgery is being proceeded very quickly. Implants are all placed. It has taken about 40 minutes.
정말 놀라운 속도로 진행이 되고 있습니다.
It's remarkable speed.
해보시겠습니까?
Can you say ah?
네, 지금 앵커 스크루 제거하시고
Anchor screw is being removed.
지금 이게 앵커 스크루가 너무 쉽게 제거된다는 것 자체가
The
볼질이
fact
좋지는
that the
않고
anchor screw is being removed very easily means that bone quality is not very good.
이상하게도 전부 일단
In the
기술이
upper,
들어가
implants
있고요.
have been placed, all 6 of them.
빼주세요. 요거 빼주세요. 선생님.
Can you remove it, please?
네, 지금 멀티
Multi-unit abutment is being used.
이 멀티 어버트먼트가 흰색
The
손잡이가
multi-abutment,
있는 부분과
there's a product with white handle and one without.
가급적이면
Preferably, when you connect it for convenience, use the one with white handle.
개인적으로는
That's what I prefer.
이 손잡이 단계에서
In the handle stage, you need to tighten
후에
as much
드라이버를 통해서
to
쏘일 때도 조금 더
be able to tighten easier using driver. If you do make it too loose, when you tighten using driver, at times it may not tighten as easily.
자, 여기서 이제 이
In
드라이버가
this stage,
걸려주면 좋은데
The driver, if it hits, is good, but if it doesn't,
환자분께 목구멍을 좀 닫아주시라고
so I'm going to ask the patient to close slightly.
이제 탁 튀어서
떨어지면
목구멍을 지금 여기서 이 드라이버 생김새가 실은
The driver,
핸드 스프링을 할 수 있게 이 부분이 있지 않습니까?
it looks like you can do hand
이
screw.
핸드 스프링 안 하고 바로 이 토크 렌치를 적용을 하게 되면
If you apply
속도를
torque
가하고
wrench,
힘을 가하기가 힘든 경우가 있어서
at times it can be difficult to apply force.
이 부분이 낮은 것이 이제 가장 챌린징.
So this is a little bit of challenge for me.
30N으로 재시는 거죠.
예, 맞습니다.
You're tightening by 30 Newton? Yes.
지금 이 부분이 왜 어렵냐면
It's difficult because
체인이 있기 때문에
there's gingiva.
Torque wrench clicks.
가장 걱정했던
15번
The number 15 is the area of concern.
저의 글러브 약간 오염이 돼서
My gloved hand is contaminated and the metal driver feels slippery, but I prayed a lot last night, so it went pretty well. At number 15, which was worrisome, the initial drill went okay. TI base is connected. The TI base, there are 3 types of TI base from Osstem. 5 degree 5 of, and 10 degrees. 10 degree is prefabricated,
제공을 할 수 있기 때문에
so it can provide the space a little bit more. So in the maxilla,
보탈물에 정체결이 여의치 않을 때
if the prosthesis cannot be properly connected,
걸리는 해당 부위에
the interfering area
4mm 때 10호짜리
4 millimeter height and 10 degree
프리머드 그쪽에
would get rid of the interference.
적용되는 그런 상황을 피할 수
So we can avoid the mistakes in the connection of a prosthesis. Now we use 5 degree ones. I trust OneGuide, so the first try in is 5 degree one as planned.
아까 전에 먼저 사전에 한번 트라이
So
살짝 다물어보세요.
this is the mandibular prosthesis that
아예 보세요.
we tried it in before.
자, 폴딩 해주십시오.
So it is adapted and the maxilla. So
보세요. 천천히
it went as planned.
어금니로
Please close your mouth with your molar. So So it went well for maxilla as well.
어느 정도 관계가 살짝만 벌려보세요.
Would you open it a little bit, please?
아,
Close your mouth. The,
벌려보세요.
he's checking the bite.
워낙 계획한 대로 잘 돼요.
So everything
다시 한번
goes as planned, and I want to check it again. Can you close the mouth?
바이트가 빠지지 않나요?
Bite is okay. Articulation paper.
정 원장님 어떻게 만족스럽게 되신 것 같은가요?
네.
Dr. Chung, are you satisfied?
약간 혈액이 오염이지만
So the occlusal contacts, not bad.
네, 배분이 되어 있는
It is
여기에서
contaminated a little bit,
임시
but
보충물이 유동이 있지 않습니까?
there is mobility in the
적합을 한번
temporaries.
이후에 다시 한번
So
교합을 잡아주고
let me check the detailed
약했던 쪽은 교합력을 너무 강하게
occlusion.
살짝
So number 12,
시멘테이션 함으로써
we will
마무리할 수 있습니다.
relieve the occlusion and cement it. So looks like the surgery was successful.
상악과 하악에 다 지금
So maxilla and mandible situation is very satisfactory. So it's all finished.
예, 정말 성공적으로 이 수술이 다
Okay.
진행된 것 같고요. 시간도 뭐 저희가
Time is good and surgery went well.
어떻게 고철로 하는 거는 좀 천천히 하시고
So are you going to take time to do prosthesis?
예, 그러면 지금까지 라이브 수술이
So
정말
live surgery
전현정
progressed very well,
저희가 Q&A 시간
and we will have Q&A with Dr. Chung
파노라마 촬영
and the patient.
포스업 결과도 한번 확인하도록 하겠습니다.
Post-op facial panorama will be taken.
예, 정말 라이브 서저리가 정말 훌륭하고 정말 계획한 대로 잘 이루어진 것 같습니다.
I can see that live surgery occurred very nicely and successfully. Dr. Chung placed the 6 implants in the upper very calmly and 4 in the lower. Successful surgery has been done.
이제 올해 나와서 저희가
And Dr. Chung is going to come to the hall and we're going to have Q&A. I think a lot of questions are being raised in the chat. I'm
상당히 어려운데
conflicted as to choose which question.
정 원장님이
Dr. Chung
이쪽에 오실 것 같은데요.
is going to be here any moment now.
어떻게 보면 어려운 케이스인데
There was a quite complicated case, fully edentulous case.
우리 정 원장님
Dr. Chung,
예,
fine here. Congratulations, hard work.
성공적으로 멋진
It's very successful, wonderful.
잘 계획된 것 같고요.
It's been placed as
저희들이 지금
planned.
많은 질문이 라이브
A lot of
채팅창에
questions
올라와
are
있는데
being raised.
아마 이쪽 저희가 이제 저쪽 대강당에서 진행하지 못하다 보니까
We are unable to proceed in the auditorium. It's difficult to put up the questions on the screen.
중에 지금 포인트
Out of the question,
ID
ID point.
저장력이 굉장히 센 사람의 경우
In the case of people with strong masticatory force, if you do all on 4, if one fails, it's very difficult to maintain fixed prosthesis. In this case, how would you be able to respond?
참 어려운 부분입니다.
It's a very difficult question.
전압 임플란트를 식립을 통한 전압 고정식 보철물을
So when I design full arch fixed type prosthesis, clinically, I can think about 2 scenarios. The first one is, like in this case, immediate loading is done, and the patient should eat soft food, but he doesn't do that, so a couple of them can fall off, and during usage, biological or mechanical complication can occur, so a couple of them can fall off. In that case, 4 or 6 implants should remain in the mouth. Otherwise, it's not possible to have the fixed type. So if a couple of them fall off, one or, if possible, two more implants need to be placed so that the fixed prosthesis can be maintained with the appropriate number of implants. In the maxilla, there is a leeway, but in the mandible, if one fell off because of bone resorption, there's no way to additionally place an implant, so overdenture or others need to be done. In Korea, the musculatory force is stronger than other countries, all on four. So is rather challenging in Korea compared to other countries. That's why the question came up. So when we do all on four, we can be faced with such problems.
사실 정 원장님이 너무
Dr. Chung
이용해서 정말 정확하게
used OneGuide to accurately place four implants in the mandible. The question,
가이드로 진입하는 것보다 차라리
compared to guided surgery, in the premolar area, the flap can be raised by checking metaforamen. It would be safer clinically to place implants.
아마 정 원장님이 마지막에 이제
So
제끼고 뒤쪽에
at the end,
때문에 아마 그런 질문이 올라온 것 같은데요.
you
원가이드의 그 정확성, 그다음에
The accuracy of
멘탈 포라멘을 눈으로 직접
OneGuide and opening mental foramen. What do you think is more ideal?
제가 오전에
In the morning,
박창구 교수님의
as Professor Park mentioned about stabilization of guide, I really found the lecture really interesting. In this case, actually, I wanted to focus on stabilization, and in mental foramen space, there was residual bone. And I'm sure you'll come across frequently and clinically if there's a really resorbed bone. In the case where stability cannot be secured, and if the patient wants fixed restoration, in my case, I would not do guided surgery because guided surgery is to allow me to place the implant in the desired position. In this case, you need to open flap. And in the lower anterior area, it can go to the lingual side, leading to vast bleeding, and in most cases, the patients are older. When you can secure the stability of guide, you need to use a if there is a slope, you need to flatten the bone. Through this question, I wanted to say that all on X cases. Personally, I use OneGuide because I wanted to emphasize some benefits of OneGuide. Can I have some time to explain about the benefits of OneGuide? Can you pull up the slide? Can we pull up the slide? In my opinion, OneGuide surgery for all on X. First of all, fixed positioning is possible. When you do all on X, so when you open flap and do surgery in analog ways, you need to think about the bleeding and angle in the lower anterior as well as mental foramen. Because of these concerns, even if you use tilted implant, 30 degrees, 17 degrees, it's not easy to get that. Immediate loading period and osseointegration period. After that, at times the angle may be wrong. In this case, the implant was placed nicely. However, if the angle is not right, you need to make a plastic cylinder and you need to do wax up. Customized abutment needs to be fabricated in this way, and then it needs to be transferred to final prosthesis. All on four in itself is that it's a one-unit prosthesis. At lab, the loss of zirconia disc is quite severe because of these processes. The lab process, the ease of fabrication is not really good. What is the benefit of OneGuide? As you can see, in the case of anterior and posterior implant, you can place it as planned. In the case of anterior, the angle of anterior and posterior implant, the angle of tilted implant in the posterior can be adjusted. This is a similar case. On top of that, you can use Implant Studio program to twist the implant and change the hex. In the first try, more so than thought, the tie base 5 degree, it did not, the angle was slightly deviated, so it did not go in properly. So I adjusted the angle, and in my second try, as you can see, the angle becomes aligned fully. As you can see, OneGuide surgery can be used to place a tilted implant, and with this, you need to use customized abutment as well as tie base. You can use it for final restoration. Tie base is in the library, so you can fully use digital technology in the lab process as well. In the case where I did live surgery, tie base of tilted implant is here. The hex angle, if you do positioning better, it becomes aligned like this. As shown in the surgery, temporary prosthesis can be connected nicely. That's my impression based on my experience. This is AP spread. We need to utilize cantilever to somewhat degree. When you do surgery analog ways, it is difficult to measure using ruler, but when you do digital dentistry, you can look at the different measurements. AP spread and cantilever length leads to, we can assume how much stress is applied to screws. As Dr. Pez mentioned, within the same coordinates, you can make a design so you know what is going to be like on top of your implant. In terms of prosthesis design, you can be more flexible.
Lastly, complication management. In this area, Paramalo is famous. So, according to his report, the complications are reported, various complications, dehiscence, fenestration, periodisease, and the various complications are reported. So, you need to use the guide after stabilizing the guide to prevent the unexpected complications. So, I use Osstem OneGuide system for all on X. Thank you for the presentation. As you said, in Korea, all on X is controversial, but using a case similar to this, I think you gave us very good explanation. And let's go to one more question. If the panorama is ready, let us know. I think this was raised as an issue from the Prosthodontics Academy. After final prosthesis is delivered, if it is a hybrid prosthesis, the patient can complain food retention. What do you think? So, self-cleansing is very important for the longevity of the treatment. So, aesthetics is important, but just like during the brain age, self-cleansing should be considered. And we need to train the patient on self-cleaning. So superfluous needs to be inserted to the area for cleaning. That's very important. and the food retention
내층으로 진행되기 때문에
can occur
실제
in the inside of the bone.
있어야 될 그 위치의 단차가
So
크게 나는 경우에는
if there is a big step,
사전에 우리가
it cannot be avoidable. So contour of the prosthesis is not just made out of blue. I use the distal denture. Here in this case, the treatment denture and the volume should be transferred to the final prosthesis. So in the process, if the gap is too big and if the patient wants a lip support, full denture for maxilla and fixed all-on 4 in the mandible would be appropriate. So lip support and the cleansability can be enabled. So that should be considered during diagnostic phase. Panorama image is available after surgery. So can we see it? Post-op panorama. What do you think?
실은 제가 말씀드리고
Actually, the surgery was finished successfully, but it was not done all by me. All on 4 is not a routine procedure in Korea. I have done about a dozen of them. So the temporary hex positioning and all the processes have been made enabled thanks to the members of the R&D Center, especially Jonghyun Park, Dr. Jonghyun Park, or Dr. Cho or Dr. Kyungwon Kim. And thanks to them, I was able to do the surgery. I just implemented the surgery based on their protocol. Panorama looks good. So through this, actually, I am given the chance to do a lecture by Osstem through analog approach, but using the digital dentistry, the predictability and completeness of the treatment would be improved. So using the digital dentistry system, more challenging cases can be tackled with a digital approach. As Dr. Chung said, that was a very good live surgery, and I believe Dr. Jung has prepared for the live surgery thoroughly, and with the help of or with the support of all